I am Dr. Nadeem Sajjad Raja. Two fatal cases of Crimean Congo hemorrhagic fever have been reported from a hospital in Rawalpindi, northern Punjab, Pakistan. One case of confirmed Crimean Congo hemorrhagic fever is still being treated in that hospital. This advice is for healthcare workers who provide care to patients with Crimean Congo hemorrhagic fever. It remains extremely important to control infection in healthcare settings. Healthcare workers caring for patients with suspected or confirmed Crimean Congo hemorrhagic fever or handling specimen from these patients should implement and practice standard infection prevention control measures. These include basic hand washing, hand hygiene, frequent hand washing, use of personal protective equipments, safe injection practices, and safe burial practices. As a precautionary measure, healthcare workers caring to patients immediately outside the Crimean Congo hemorrhagic fever outbreak area should also implement and practice standard infection prevention control measures, as I mentioned a short while ago. Samples taken from people with suspected Crimean Congo hemorrhagic fever pose a great threat to healthcare workers, should be handled by trained staff working in suitably equipped laboratories. Also, you need to practice standard infection prevention control measures because this virus is hazardous to human being. Thank you very much for watching this video.